Okay, we're here at iCarbonX and we have the privilege to interview one of the founders of the company. Can you maybe explain us a little bit what iCarbonX is doing?
Hi, I'm Ying Rui. I'm the chief scientist of iCarbonX, and we are trying to implement the data analytics engine to help the general healthcare industry to provide more personalized service and better service and products to the consumers who would like to have a better choice for their healthy agent.
So you're basically a data company that collects data from different sources about people's health, giving them advice. What are the key data sources that you use for that?
We work on very different types of data. Some what we call the like molecular biology data. That includes the DNAs, including RNAs, the proteins, metabolites, include a lot of small organic molecules. And we also get the data from this the physical data. The physical data includes what we call all those vital signs, and also we are collecting some of the social behavior data from all the smart devices, mobile healthcare devices. So it's a combination of the new molecular omics data as well as the conventional medical records data. That's a combination. Yeah.
And what's your dream, your ambition with the company?
So we hope that with our effort, we can start to build up a model, a mathematical model for the human health, and we hope that would help people to live long but very healthy, and we could help. We hope that people could get rid of most of the disease, and especially for the chronic disease, we hope that people will be happier, and that's a key. So for some parts, that we also want to enable the conventional health industry, such as those wellness spa, such as the gym clubs, as well as the medical hospitals, to be empowered by this mathematical model to give better prescription and also earlier intervention and to keep people healthy.
What is the hardest part to convince the hospitals and the health clubs and the gyms to participate?
First of all, nobody did this before.
Okay.
So the special difficulty of our business and our analytics is we needed to have a intact understanding of people. So we need to piece together the fragmented data from all the scenarios that one go through. So we need to simultaneously understand your data from very different scenarios, like what you need, where you sleep, all those type of things. So if you want to cross all the use cases, it's very hard, and it's also very difficult to convince the what we call the vertical domains to open up, to really make their data accessible to the other vertical domains, to give a holistic decision to the consumers or to the patients. And also, it's a very abstractive when we talk about the data. When we talk about how the data could really help people, sometimes we have to build up our own apps, our own community health centers to help people to understand what this really is about, and how to what extent there's the power of the so-called big data in healthcare would really help people on what aspects.
We've been here with a group. Behind the camera, there are 30 people watching us, and we had the pleasure of visiting your company. Thank you for that. At a certain moment, you said during the tour that the fact that you're moving from diagnostic healthcare to preventive healthcare,
Yeah.
that is a major mental shift for
Yeah.
especially doctors. Can you talk a little bit about that?
Yes, no matter it's diagnostics or it's screening, it's already talk about where you are now. So it's diagnostics, right? They are trying to make it right when they just describe you correctly.
Yeah.
So that's diagnostics. But when you already got that diagnostics, when your body already can be mirrored in that way, that means that you have to be in some status for a while until your body accumulates that outcome.
Yeah.
So nobody would have a disease in one day. So it has to be a curve, some trend line, for a long time. So if we can capture the data from a lot of different layers, internal molecular biology, external environmental factors, your behaviors, your lifestyle, all those type of things, it must be some factor that is early on that is finally lead the outcome when you get some diagnostics as a disease. So if we can capture that signal in your earlier data, we should be able to prevent the disease from happening. And luckily enough, if we found things really early on, most of the intervention, what we call the health care management, is nothing to do with taking pills or very serious inpatient care, something like that. We are not talking about that part. Most of the health preservation could be resolved by lifestyle changes, very light intervention of your diet, of your exercise, of your sleep, for example.
Yeah.
So that's the key. But in a technical perspective, diagnostics, they already have a direction to diagnose, and they already have an outlier of your data. But in prediction, you have to predict for a lot of different directions. You have to predict your trend line, whether this is to Alzheimer or this is to lupus, for example. But for the prediction has multiple directions, and also it's very early, so the signal is very weak. So you have to integrate a lot of different data to make the classification correct.
Yeah.
So it's prediction, it's different thing.
Well,
Yeah.
many people are going to watch this in Europe, and the question that Europeans always have is about data and privacy.
Yeah.
Often in Europe, there's the perception that in China, privacy is less important than in other parts of the world. You have here very personal data.
Yeah.
What is the situation here with healthcare data and privacy and data protection? What is it like in China?
I think it was a illusion that Chinese people they don't care about their personal data. Actually, not.
Yeah.
The Chinese people, they are very much they are very much emphasizing on their personal data.
Okay.
So the first of all, we have to sort of like iterate that personal data belongs to people who generate that data. So that's by law.
They own the data.
They
by law.
own it.
Yeah.
They are the owner of their data.
Okay.
So why you are able to access that data is because that with a certain access, limited but adequate access, you can give them a better service, like or a better product based on their own data profile. So that's you do. That's what we do. It's just like again, I like to use the example like a GPS navigator. Mm-hmm. So you should only share your location to some application when you really need that service.
So you get value.
Yeah, you get a value from that. So I'm not a fan of about what we call the sharing the data. I'm not a fan of that. So what I'm trying to say is you always get some value when you let the application or the product or the service to access some data. But that data has to be as I said, it's limited but adequate just for that application.
Yeah.
So only when you use that application, use that service, and your data for that part being accessed. that's very important in terms of design of the business model, in terms of design of your whole IT infrastructure and system, and a lot of the data analytics pipeline. You have to put that in your awareness.
Okay.
So yeah.
Maybe last question, is your plan to focus on China, or do you also want to go to US, Europe with your company?
We hope that we can find a lot of collaborators with the same vision.
Yeah.
No matter they are working on data analytics as we are doing right now, or they are more upstream, like they can have some their device, or they are doing some tests, something like that is our upstream, or they are downstream, so they provide direct service to customers. We certainly welcome collaborators from the every corner of the world.
Okay.
The interesting part about the healthcare is some of the experiments generated from one population can be transferable to another population. Okay. But most of the times you have the local context into that. So I don't think that academics would do them all. So we are positioning accurately into the whole industry, and just to be a data analytics engine algorithm. We are playing the algorithm role. So we need a lot of joint forces everywhere.
Okay.
So yeah.
Well, thank you very much, and thank you that we could be your guest here.
Yeah. Thank you.
It was
Thank you
a
very much.
pleasure.